was very happy when somebody commented about the use of African languages in translation. I mean, and my discussion is going to revolve around that. And it's very clear that right now the AI is probably the third industrial revolution that is going to happen, and we're going to see so many changes in our lifetime. And also somebody talked about collaborations in academia. So 2 years ago, I made a presentation at Kenyatta University to medical students. And one medical student told me, hey, you guys come from abroad with wonderful ideas. Why can't we have that solution? Why can't you bring that solution here? And so I asked him, are you ready to do this? He said, yes. So we actually, some Gen Zs came up, there are about 8 Gen Zs, and we said we're gonna try to revolutionize, healthcare in Africa using artificial intelligence. And so the talk revolves around, an application that we have created. It's a product. It's actually a company already, and we're already actually in business and trying to solve certain problems. But let's backtrack. So these are the guys. So Modoni has a degree in business from Strathmore. Derek is the AI engineer. He's a student at Kenyatta University. And I have other team members. You can always scan the QR code to find out about the other team members, including medical students. I remember to put this slide here because I made a presentation elsewhere and I forgot to mention about them. Yet they're the ones who have really done the real work. So we call our company Pawanax AI. But let's backtrack. If you look at the health status in Kenya, I mean, some of the statistics have already been alluded to as far as malaria, for example. If you check on this, you'll find malaria somewhere as one of the major health status indicators. Somewhere. Malaria is right here, right? So that's about how many people, 120 out of every 1,000 people have malaria. So the statistics are still there, and that's not what we need to worry about. What I needed to draw your attention to is on the health system indicators, because, for example, we have only 2.6 doctors for every 10,000 people. So that is 0.26 of a doctor in every 100 people. So very few people indeed, and this is very generous. Actually, the actual ratio is about 1 to 600 doctors in Africa, and worse in certain regions. And so if you look at all other system indicators like clinical officers, number of facilities, you realize that there's no way we can be able to solve some of those problems without being more innovative. We can say we want to train many doctors, but how many doctors do we train a year? For example, in Kenya, it's not that easy, right? Not to mention the complexity of diseases like malaria that we just heard about. So for that reason, therefore, we thought that we need to think more deeply and start finding out how can we use artificial intelligence to try and reduce some of these problems that are in Africa. Many of them are very clear to you. The physician-doctor patient ratio is already mentioned that. Access to essential services. If you think about your village, how far is the hospital from where you live? Where can you get a specialist? And how long do you have to wait? In fact, even in the US, we wait for long to see specialists, right? So what about in Africa? So the whole idea here is to find ways to increase access. Delayed diagnosis, like malaria, one of the problems is delayed diagnosis that brings about a real problem in Africa. People stay with it, especially men. Ati niko sawa tu, nisaidia maji ya kunywa. I tell my son, if you are sick, say you are sick. Don't communicate, talk, right? Appointments, how often we have to wait for appointments for long? Even in the US, to see a doctor, a specialist, it takes long. These appointments take long. So certainly we need to find ways. Then somebody mentioned about language barriers, and that's a big problem. Haven't you ever realized that medicine is taught in English and French and Arabic in Africa, but practiced in local languages? So there's a big disconnect. Daktari anakuuliza ilianza lini na mgonjwa anasema nini, and then the most learned member of the family who brought the patient now takes over and start talking about the patient. And many times they exaggerate, and so all that is lost. So how do we surmount the language barrier? We have over 100,000 different languages in Africa, right? So we think that artificial intelligence is God-sent, and that is opportunity to really just try and reduce that. But let's go back and give you some good numbers. Have you ever known that actually the Africa has more cell phone users than the United States? It's a fact. There are twice the number of cell phone users in Africa than in the US. So certainly there's an opportunity to reside, solution on cell phones to be able to reach people. That's why the M-Pesa work. That's why many applications are working. That's why gambling is working in Africa. People are now gambling because it's on the phone, right? So they actually double. And the internet users in Africa is actually a third of the African population. African population is 1.5. 570 million people use the internet. So we can try to find solutions around that. And the number is growing every day. In fact, in Kenya, there's 121 penetration rate of the cell phone use. So there are more cell phones than the population in Kenya. So that means that we should be thinking of ways to teach. You guys have talked about how do we reach the local people. The cell phone can be one viable way to reach them. And it gets interesting, right? So let's look at this. Well, region-wise, we can say Swahili. There's a lot of Swahili. There's this language. Have you ever heard of this? There's Tuareg. There's Masri from Misri. So these languages are, region-wise, they are a bit spread out. So we think that we can try, first of all, to begin and creating an application that can speak these regional languages so that the communication between the doctor and the patient can be more enhanced. And we are not joking. So if you are a businessman and you see I work in industry, and like in academia, in industry, sometimes you are given all the money and they tell you, give us a solution. So sometimes we feel like we are wired that way. And so if you are doing the math, if it is just 1 shilling subscription, you have 7.7 million shillings in the bank. So that's how wild you need to think that that if it is just 1 shilling subscription, just a shilling, you'll already be a millionaire. Okay. In Kenya, there are actually 27 million internet users. 27 million. There are 27 million internet users in Kenya. So if you are thinking of a way to reach people, let's try to begin thinking how to do that. And so we created an AI doctor assistant and also a personal AI doctor using AI tools. We are calling it Pawanax AI. But let me teach you a little bit of medicine, although I'm not a doctor. So doctors use what they call the SOAP notes when they are trying to diagnose a patient. So SOAP stands for, first of all, subjective is subjective information that the patient comes up with. Unamuuliza unaumwa na nini? Ati naumwa na hapa. Hapa ni wapi? Hapa karibu na tumbo. And sometimes the subjective information is in form of moans and groans. So that's the information you need to get, right? And then objective information is the one that, is measured, enda kwa lab, ipimwe, temperature, and all that's objective. And then the doctor has to make an assessment, in terms of these two, and then provide a treatment plan. So ideally, they follow a SOAP methodology to be able to provide you treatment. So we think that we can use the same and find a solution that can collect subjective information, objective information, and be able to create a solution. By the way, how many times have you heard that amekufia njiani akienda hospitali? Ama alikuwa anaongea sasa haongei. So how do you get information from that patient? So what we think that it's possible to have a cell phone that is collecting information as you are taking the patient to the hospital. Right? You can even take video as they are going to hospital. So akisema ni hapa, you are getting the information so that the doctor can have the S part covered. Otherwise, the patient is not going to say anything. Right? So we are trying to convert that. So if you have your cell phone and if you scan this, I believe it should take you to our application to the site. If you have a cell phone, just